Hi, everyone. My name is John Faulkner. I'm your host of the Smarter Systems, Better Care podcast. And I'm here today sitting down with Catherine Grant. She's a founder and former CEO of ExperCARE. She's a leader in innovative healthcare and a community-focused patient care. Welcome to the podcast today.
Thanks for having me, John.
Absolutely.
Thanks. So I'm a PA by training. I've been a PA for a little over 20 years. Founded ExperCARE Health a little over 16 years ago in my husband's hometown, Richmond Hill, Georgia, and have had the great fortune of being able to lead and grow that company over the last 16 years to a multi-location, multi-state business providing on-demand healthcare. And in April, I began my transition, hired my successor as CEO, and so have moved to the board of directors to continue influencing the company from a strategic standpoint, but am really excited about the operating team that we've got leading the company in this next season of growth.
Excellent.
Sure. So more focused on the strategic direction of the organization, whether that be growth, service lines, and really helping work with the management team that's running the day-to-day operations that are delivering the services to make sure we're focused on the right things, the relevant things, and continuing what ExperCare has been known for the last 16 years, which is 5-star service, customer service to our to the communities that we're in.
Where do you spend the most energy driving your growth during the day?
Well, I think urgent care is on-demand healthcare, as I think about it now, is really uniquely positioned because consumers seem to gravitate toward the accessibility and the convenience that urgent care provides. And so what we found over the years is that people continue to want to get more healthcare services from that model. And so I spend time thinking about, where is the industry going? What should we be thinking about as we add ancillary services? And what should we be thinking about stopping doing, right? I think that's an important question for all leaders, not just what more are we going to do, but I think it's important to ask ourselves, what should we no longer be doing to make space for the additional things we should be doing, and how we stay relevant in an ever-changing healthcare market space. There's a lot of conversation these days around, the healthcare model and what's working and more about what's not working with it. And I think, when you highlight some of the things that are working, access to care and urgent care and the model that's been set up there is working. And so I'm a big proponent of looking at how we can pour gas on what is working in something versus focusing on what's not working, and lean into the momentum that's being created there.
Absolutely. It sounds like, I think too, from our last conversation, you're actually adding urgent cares. Is that correct? So you're building new centers.
Yes. So we're excited. ExperCare is adding to its footprint. We're currently in Southeast Georgia in the greater Savannah area, extending up into Statesboro. We're up into, Effingham and Richmond Hill and Hinesville and small towns sort of in the greater Savannah Low Country region, if you will. We're also in Tuscaloosa, Alabama. We've got 6 locations there. And so we're beginning to connect the dots between those. So this year we're going to be going to Huntsville, Alabama, adding several locations there. And then we're also going to be expanding up into the Macon market in Georgia, which is a little further up I-16 toward Atlanta.
Excellent. And as you're growing, do you find the key to your growth partnering with nearby hospitals to then refer patients, or how does that work from a bigger perspective of making sure that your business is growing, but also kind of educating patients hey, you don't have to go to the ER for that issue. You can come to urgent care, right?
Right. It's all about community education. And you just hit on an incredibly important point, which we don't talk about enough, I think, which is, community health is so much of it is dependent on educating consumers on, where to get their health care. So
Right.
we don't have formal, relationships with the hospitals from a referral standpoint. We are independent from that, but we do work together with lots of other specialties in the areas that we're in, and say, hey, how can we help you when you're not open, when maybe you're at capacity? How can we help on an episodic basis and then get people back to you when maybe you don't have the hands and feet to deliver that. So I think that's a great point too, is that healthcare has such an opportunity to work together more versus staying in each of our specialty and sort of health system silos, and figuring out how do we not just compete, but how do we work together so that the consumers, benefit from that?
Yeah, absolutely. And then I always like to ask people, like, since you're in like the urgent care business, what makes you different than other urgent care companies out there? Because I know, and especially in the last 5 years, it seems like there's been a huge growth or influx of urgent care. So, like, what would be like, I guess, your 30-second pitch? That's probably the best question.
Yeah, I think that, the thing we've stayed focused on as we've grown and ever since we were one location is, the five-star customer experience. How do we make people crazy to go anywhere else? And that is in the little things, right? It's how we deliver things, not what we deliver, which is urgent care. It's how we deliver those
Right.
things and how we build trust with people that they know what they're going to get when they come in, they know they're going to get followed up with. And so that's one component. The other component, what I like to say of our secret sauce or kind of our unique thing to the business is we want our team to have the same experience. We want our team to have a five-star experience because they're the ones that are delivering the services. And so I'm sure we don't get it right all the time, but we never stop striving toward really focusing on a five-star team experience as well.
Excellent. That's amazing too. It just like you said, paying attention to little things makes a huge difference over time, and people notice those things. So it's a good call out and focus area.
Absolutely.
Yeah.
Yeah, consistency is what builds trust. And I as people are thinking about building their businesses and how do I get more people through the door or how do I grow? A huge part of that is the trust that we build with the consumer, with consumers. And I think too often in healthcare, we say, well, people have to come to us. We're in their network or we're on their insurance card or, they're primary referred them to us. And I think that we have an opportunity to really think bigger than that
Yeah.
and learn from other industries about how do we become more than just, the baseline and
Yeah.
how do we delight our
Delight.
consumers,
Yeah. Exactly.
right?
Yeah.
How do we create an experience that delights them where they'd be crazy to try to go anywhere else? And so to me, setting that bar a little higher is what ExperCare has always done. And I think that great leaders continue to strive to do.
Absolutely. The one that always comes to mind, I'm sure you've heard the analogy before, is Amazon, right? The Amazon type experience, like
Huh?
they're obsessed on customer service, providing excellent, and they revolutionize, like you kind of are saying, like, let's just not think of ourselves as an urgent care, but we're like, let's think about this as like a 5-star experience. Like, how can we really elevate this to make it, you know, oh, I have to go to the urgent care is how somebody might have to think, you want to be like, oh, I'm going to go to ExperCare, right? So,
That's right. It's end to end, and it's thinking about, I love what Amazon does with this is they think about, how do we create seamless transaction for
mhm,
people? If there's anything that healthcare can learn from is learn from that, right? I think that we can all agree that it can be very clunky. I wouldn't describe most healthcare experiences as seamless
no,
yet.
not
But the
yet.
exciting part is, yeah, exciting part is, the technology is advancing at just exponential rates to support a more seamless experience. So I think in healthcare, we have this opportunity to embrace that and really harness it to create that experience for our patients, customers, their families.
Absolutely. And then kind of zoom it out even more on your industry, like what's one shift in your industry that most leaders are not paying enough attention to?
I continue to say that we all know there's this shortage of primary care and primary care providers in our country. There's been a lot
Yeah.
of conversation
Huge
about
shortage.
that, big shortage, and there's also ERs are overfull, long wait times. ERs are in hospitals have shortage of beds, and so I think that urgent care has this opportunity to do more than delivering just episodic urgent care. Urgent care is very well positioned to take on some of the continuity of care things that we've assigned to primary care in the past. And so I see this merging of those things, and when I don't think that urgent cares are going to turn into the old model, I think that, access to preventative care on sort of an urgent care chassis, if you will, is something that's not being talked about as much as I think it should. Because I think it's what consumers are asking for. They like the convenience, they like not having to make an appointment, they like the access. And so if we can figure out how to deliver some components of that preventative health care on an urgent care model, I think we're gonna see community health really improve in the communities that we live in.
Yeah, absolutely. And like take the burden off of the the healthcare system as a whole, as like you said, we're reaching out to the community, educating people, like what can you do at an urgent care? That's probably like, if
Yeah.
you less traumatic injuries we can take care of. If you need an x-ray, then we can triage you to see, do you need to actually go to the hospital and go from there. So those are like a lot of the things it sounds like you're working on as well. So
Yeah. One of the things I've always told people when they say, "Well, what all do you do?" And I say, "Well, it's easier to tell you what we don't do."
don't do, yeah.
And in most cases, I think it's great advice to just come in, let us sit next to you and figure out, can we solve this entirely here, or can we help you get where you need to be, and take care of you along the way. And so, if you think you are actively having a heart attack, or you think you're actively having a stroke, urgent care is not your first place you want to go. That is what
Right.
the ER is for.
Absolutely.
You have a loss of limb, loss of vision, that sort of thing. That's what the ER is for. But most things in between that, for most age groups, it's a great first stop to help figure out, hey, is this an easy solve, or does this need more of a workup? And if so, can it be done here, or do we need to get you somewhere else to get that done? It's a thought
Absolutely.
partner in a lot of
Exactly.
ways.
Yeah, for sure. And then when you look at like kind of closer honing in on the business side, like looking at the operations day to day, where do things feel like clunky or slower than you like? Because I know you're kind of transitioning out of that operational mode, but what are things that maybe you saw trend wise you were consistently running into?
I think as healthcare as a whole has an opportunity, for patient intake, to really stream that with technology and get rid of paper. I think some organizations are further along in that than others,
Yeah,
but being able to do everything through your phone. I also think that documentation for providers and using technology to aid in documentation, for providers who are in the visit, is going to transform healthcare, so that we won't have a laptop between us and the person who's taking care of us. So I love seeing the strides that are happening with that, but with strides come operational glitches as you're resetting to a new normal. And so I think that's what many organizations are pushing through right now, is figuring out those things. And as you kind of reset to a new normal, that's going to be better going forward.
yeah, absolutely. And then this is a little different question because I know it's like an urgent care model, but I usually ask like practices and these kind of questions. So, like, how do you work with the patient? Say they come in to see you, maybe not a very urgent issue, but you need to follow up with them. Like, what does that process look like in a urgent care model? So then that way you don't
Mhm.
like lose them and they return again in a day or two because the problem got worse. Like, how do you manage that?
Yeah, that's a great question. So, for one of the first things we ask during intake is whether someone already has an established primary care provider, and if they do, we want to engage that person. We're not trying to take over that role. But if they don't, we do know that in many of the communities we're in, it takes a long time to get in with one. So we want to be able to kind of stand in the gap for them during that time period. And so we may change our follow-up recommendations for the visit based on whether they have an established primary care provider or
Or
not.
not? Okay.
And so one of the processes we've set up in the company, I've been doing it for a number of years, is something called callback. So we call every patient back 48 hours after their visit to see how they're doing and make sure they don't need anything. One of the ways we amend that process, if something's more acute, is we do a 24-hour callback. If something, if the provider thinks that, hey, I really want somebody to follow up with this person tomorrow because they may be a little higher risk for whatever reasons, we'll do a callback then. So there's things like that we do. And then obviously within our electronic health system, we have ways to sort of trigger those follow-ups as well to make sure follow-throughs on labs that are done and imaging and other diagnostics, we're able to follow up with people.
Yeah, those are all amazing tools too, like you said, in specific intervals, and they may be smart enough based on the patient's acuity or how, serious their problem is. You can follow up at the right intervals. So
Yes, which is
absolutely.
huge. I mean, reminders and things like that, if our true north is improvement in community health for the communities that we're in and for our country, you know, we have to figure out how to partner with people and meet them where they are, and communicating and remind them what they need to do to stay on top of these things.
Absolutely. And then and again, in your current, like, operations, like what's working really well right now that you would never want to lose?
I think our team member just passion and commitment to the mission. We've got such a great devoted team of people who are committed to figuring it out for people and serving. And so to me, they're the heartbeat of the organization. And we couldn't do it without them.
Yeah, without an amazing team, like, you
That's
know,
right.
troubleshooting issues, working on them together, getting to a common solution that works for everybody, right?
Absolutely.
Yeah.
Absolutely.
And kind of the alternative too, like what's been harder than expected, in the urgent care space, despite all the effort you throw at this one particular issue? Is there something that keeps popping up in operations?
I think revenue cycle management is it's complex. And I think that is one of the things that I hear, you know, every organization, leaders across specialties, grow frustrated with how complex it is to manage revenue cycle and deal with all of the various plans and various policies related to reimbursement and holding payers accountable to the contracts they're in. Uh, and so it seems to be taking increasing bandwidth to do that. And so I think that, technology can be our friend in that if we have the proper processes set up. But I also think oftentimes patients don't understand what benefits they have. So policies and plans get more and more complex. Um, there's all these little carve outs and nuances that maybe patients don't understand when they opt into their plan. And so unfortunately, providers are on the front lines and they're having to explain these insurance products to patients. And so that's a very challenging situation in the current model. And so because oftentimes they're catching the brunt of something that they weren't part of selecting in the
Yeah.
first place.
Yeah.
So I think, as we talk about educating the community, I think we've got a huge opportunity to also educate people on what type of insurance do I have? What does that really mean to me? And what should I expect? How much should I be saving, per month for unexpected healthcare costs? Because insurance isn't going to cover everything. And so I think there should be a conversation around that.
Yeah. The complexity of the payer landscape is kind of out of control at times. And there's not
It
just one,
is.
there's many. And now there's an influx of even private insurers that are coming into the market as well. So you're trying to navigate that. Or I'm sure patients come in from out of town. Maybe they're traveling down south, they're not in their normal, atmosphere. It's a little different, trying to navigate that as well. So it sounds like you have a really well-oiled machine helping people out and getting them educated on where they need to go.
We do our best. And I think that is the goal, though, is to not be adversarial about it, to
Yeah.
come alongside people and really educate them, help them understand. And I think as a nation, we can do more of that.
Absolutely. And like, say you get past all these barriers, in a perfect world, in the urgent care world, it's perfect. Where do you guys want to be in 6 to 12 months? Like, what's your goal?
Well, as I mentioned, we're expanding our footprint, so we'll be able to reach more communities. And I think that, expanding urgent care services to truly on-demand services where we're also providing preventative healthcare services for people on an on-demand basis. So that to me, expanding from just episodic to that in communities where there's a shortage of primary care, access to primary care, that's a huge part of our mission as well.
And on demand, are you speaking to like telehealth, like on demand, like on a mobile device or something, or some more instantaneous way to connect with the patient?
So I use the term on demand to just mean we do use some telehealth to support our brick and mortar services, but what I use the term on demand to more describe not just urgent care, which is diagnostic. Oftentimes, like I'm sick, I have a sore throat, or my ear hurts, or I have a cough. That's off, or I have a cut, I need stitches, or I think I broke my arm. Those are the things that are sort of episodic and like have a chief complaint and require a diagnosis. I think of that, is traditionally how urgent care was framed. I think of on-demand care may mean, hey, my wife says that I'm supposed to go get like a checkup and I haven't had one in 5 years. Is somebody supposed to draw my blood or something? I don't,
Yeah.
and just, somebody were to stop by and ask for that. Could you get that wellness visit done? And I think the answer is yes. I think
Yeah.
that, for fairly straightforward things, and obviously if you have highly complex problems, that's going to need to be managed either by a specialist or internal medicine. But for straightforward preventative healthcare, the providers who are staffing these urgent care centers are trained in those things as well. And so I think that we have an opportunity to tap into that to decrease the shortage of care.
Yeah, that's an ingenious way to do that too, is on demand with preventative services, I think is what you're speaking to. Um, yeah, that would be amazing because 'cause there's a backlog, especially larger health systems. It could take them 3 to 6 months to get in, which what's happening in the meantime is they're going to their urgent cares. They're doing it basically anyway, right? They're trying to get care to help them get to that point or get to someone to help manage their care. So
Right.
yeah, that's an amazing solution. And then so if you got through this bottleneck, more on-demand care, what would that free up for your team to focus on? Like even thinking more like you are now, like revolutionizing the on demand, what that means for urgent care. What's like another thing you guys been thinking about?
I think it's continuing to refine the experience to make it as seamless as possible
Yeah,
for patients and, to really to expand the footprint further so that we can serve more communities and then continuing to pour into our culture for our team because we know that to deliver these five-star experiences, we've got to keep pouring into our team so they have a full cup to pour from. And so I think that circle, that flywheel just never stops. But I think that, we're well on the way there.
absolutely. Well, thank you for your time today on the podcast. Had a really great discussion, learning more about urgent care and even the unique perspective of having those patients that are looking for preventative care as well, kind of catching them and on demand, like you said. So thank you for sharing what you guys are doing. And then where can people find you if they want to connect?
I'm on LinkedIn, Catherine Grant on LinkedIn. And so connect with me there. Shoot me a message. I'd love to hear from you.
Excellent. Well, thank you, Catherine. It was wonderful to have you.
Thank you. Thank you, John. Thank you for having me. Take
Absolutely.
care.